Okay, very good morning to all of you. I'll be talking about engineering in medicine. You are all, whoever is assembled here, you're all accomplished practitioners of science. I'm a student of science, but I still hope my perspectives as an engineer and a budding entrepreneur will give at least one or two things to enrich you. So engineering in medicine, the basic principle that underlies engineering in medicine is that all processes and all systems have a synthetic component and a natural component. And that's obvious from the term engineering in medicine. Engineering will deal with the synthetic component, whereas the natural component will come from biological principles or medical principles. In today's day, these are the general areas in which engineering in medicine can be classified into. There is biomedical devices. You can think of this as the silicon chip or microchips that are going into your computer, the same things going in your body and functioning differently in the body. Or newer tools for minimally invasive surgeries, how to cause the patient least amount of harm, how to cause least blood loss and yet be efficient and accomplish the task of the surgeries. Those are the main challenges in medical devices. In computation, there's so much information, so many patients, so much data. So computation allows collection of data and analysis of that data, and that increases the predictive capacity of doctors. Then to determine if all these nice devices and all these nice technologies are actually functioning, we have biomedical imaging. I was doing an internship 2 years ago at Stanford School of Medicine, where we were trying to optimize the audio reception of cochlear implants. And a good way to know to actually test if the implants are functioning was to carry out infrared spectroscopy and fMRI scans of the brain, of the occipital lobe, to see the audio reception activity of the cochlear implant. Then there is cell and molecular engineering, which involves manipulation of cells and their systems to produce beneficial molecules. So, for example, certain pharmaceutical chemicals. Recently, studies have shown that bacteria such as E. coli can be engineered to increase the production of lipid cells so that they can produce more energy. So it has pharmaceutical applications that can be used for other engineering purposes also, industrial purposes as well. But the basic principles are those of engineering and medicine together. Then there is the field of regenerative medicine, and we have a master of regenerative medicine sitting with us today. It's got to do more with stem cells, tissue engineering, stem cell engineering, and for creating new organs and creating life, as Daddy spoke about earlier. So for the rest of my talk, I will speak I'll speak about a new technology called as BioMEMS. MEMS stands for Micro Electromechanical Systems. Now, this is a very interesting technology to talk about and to know about, because traditional engineering, chemical engineering, mechanical engineering, civil engineering, etc., they have all dealt with minute details of very large things, very large items, very large processes. And here the scales, when you talk about the body, the scales are naturally in the micro and nano level. So it's very different scales from what traditional engineering is used to. And while electrical engineering has revolutionized operation in the micro scale and nano scales, the biocompatibility is a main challenge. Can the same silicon chip that goes into your computer go into your body and perform a beneficial function? So that's always a main challenge. So the main two things in BioMEMS are lab on a chip. So that integrates experimental procedures and other scientific procedures on a single chip. Now, last semester for one of my electrical engineering classes, I was able to miniaturize an EEG machine, an electroencephalogram machine, to a size of a palm. And that was pretty easy to do, drawing on principles of a concept called integrated circuits. So integrated circuits deals with miniaturizing and condensing together multiple circuit elements as efficiently as possible. So BioMEMS is concerned with one, miniaturizing of lab processes. The other thing it's used for is point of care diagnostics. So diagnostic devices in the clinic where you can test and diagnose on the spot. It's also used for sensors and tissue engineering. The main materials that are used here are silicon, but that again has challenges of biocompatibility. Better alternatives are materials such as polymers and plastics. Now, polymers are more biocompatible. They are chemically inert, they are electrically insulating materials, so they can be put more easily into the body and used effectively. There's also, I must mention, a lot of these devices have very, very, very small amounts of fluids running through them. These fluids can be blood samples or antibody solutions, etc. And these are very, very small amount of fluids that are manipulated to, and their flow is harnessed for the device to function. All this can be better illustrated by an example of BioMEMS, which is the CTC chip. It's used for detection. It's a small device that's used for detection of circulating tumor cells for cancer diagnosis. One can think of this as a liquid biopsy that allows you to see the metastasis in action from the malignant tumor to rest of the body. And as far as engineering, the engineering mechanism is concerned, this works on principles of fluid mechanics, where the device detects the formation of micro-vortices in the flow of the blood, and the molecule of interest, that is the CTC, is coated with a biomarker, epithelial cell adhesion molecule. And it's a very efficient device that enables detection of the CTCs, which are very, very rare in the blood. So one out of billion blood cells will be a CTC cell. This is a schematic of the device opened out. There's the blood flowing, and a pure solution of the CTC cells is obtained. In this particular device, the CTC cells were separated by detecting the biomarker by applying a magnetic field inside the device, so that based on the biomarker, the CTC cells are deflected outwards. Now, I'll use another example to talk more broadly about how the different areas, be it devices or stem cells or molecular engineering, all of these come together and reiterate the principle of a synthetic component and a natural component working harmoniously together to give a good medical function. Now we all know the disadvantages of and the many limitations of the current treatments that are available for end-stage renal disease. There's dialysis, which is an external treatment, and it's a short-term treatment. Then the actual number of kidney transplants that are taking place are exponentially less than the number of patients who need them. That's because finding a compatible donor is so difficult. So this particular bio-artificial kidney is a small electromechanical device that works mainly as a miniaturized renal assist device. So whatever RAD that is existing, this is a miniaturized version of that. It has a synthetic component. It has a porous silicon membrane which carries out ultrafiltration, and then it has a natural component. That's the transplanted proximal convoluted cells are used on a fibrin substrate in a two-chambered structure. Now, this is implanted as shown in the figure, and the implantation procedure is the same as that of a kidney pretty much same as that of a kidney transplant. It's a very efficient device, especially in the ultrafiltration region, where the silicon membrane is so efficient that no external pump is needed, and the device works perfectly fine on blood pressure alone. So the whole thing into getting into, the whole purpose of getting into details of two specific examples was to just give a small window into the large number of possibilities, the myriad possibilities, and the number of engineering challenges that are there, as well as how engineering principles can be used very, very effectively for the benefit of medicine as a whole. For a budding entrepreneur like me, and for accomplished practitioners of medicine like yourself, this gives us a lot to not just think about, but also to look forward to in the future. I hope I hope in future these technologies actually come into your practice, and that we as a young generation can do something to in that effect. Thank you so much.